Namaskar. Welcome to the 8th episode of Satya Samvad. The global health landscape faces unprecedented challenges, diseases proliferating despite advances in medical knowledge and technology. Despite significant investment in research across multiple disciplines, including physics, chemistry, biology, and engineering, some diseases remain elusive to diagnosis and treatment. In contrast, pre-colonial India boasted a healthy populace with a robust understanding of health and effective indigenous medical systems like Ayurveda. However, the dominance of Western medicine during colonization marginalized these traditional practices. Now, today, there's a resurgence of interest worldwide, including in India, in alternative approaches like Ayurveda, signaling a shift away from the solely chemical-based treatments. The systems approach of the Tridosha model of Ayurveda holds a lot of relevant and intriguing aspects that have been found to be effective in diagnosing and treating various physiological conditions. Having said that, in today's world, it is important to delineate what is truly scientific within Ayurveda, as well as to protect this age-old tradition from those who want to destabilize it due to ideological reasons. To discuss all this and more, we have with us one of Bharat's most illustrious scholars of Ayurveda, Dr. Rama Jayasundar. We welcome you, ma'am.
Thank you.
Dr. Rama Jayasundar is head and professor at the Department of Nuclear Magnetic Resonance at AIIMS, New Delhi. She's had a rather fascinating trajectory, having received her doctorate in physics from Cambridge University with training in nuclear magnetic resonance. While pioneering biomedical NMR work in Bharat, she went on for a medical degree in Ayurveda, the BAMS, which is the Bachelor of Ayurvedic Medicine and Surgery, and today is one of the few people at the national and international level to hold prestigious dual degrees in physics and Ayurveda. Her current research interests harness the distinctive facets of her expertise, which include NMR, physics, Ayurveda, and allopathy, to shed light on the scientific basis and working of Ayurveda. So, ma'am, you have had a fascinating journey. And in the sciences as well as in life, transitions are often important to understand how realities evolve. Nobel laureate Venkatraman Ramakrishnan, whom I had the privilege of interacting with closely at Cambridge, had quite a journey himself from physics to structural biology, and that made all the difference. I believe that the period between your doctorate in physics at Cambridge and acquiring your medical degree in Ayurveda must have been pivotal in where you stand today. Could you please tell us a little about the same?
Thanks, Mrityunjay, for inviting me to Satya Samvad. And thanks also for that very kind introduction. And thanks as well for beginning the discussion with this question. It is indeed, the work that I did between my doctorate in physics at Cambridge and acquiring medical degree in Ayurveda has been very pivotal in where I stand today and what I am doing today. So the work I did between my PhD at Cambridge and the medical degree in Ayurveda has been a very interesting journey for me. I had worked in various aspects of this amazing technique of nuclear magnetic resonance. It is also known as magnetic resonance or MR. So I had developed hardware for MR scanner. This involves physics and engineering. I have written radio frequency pulse sequence programming. This requires knowledge of quantum mechanics. And I have also gone on to do MR imaging and MR spectroscopy with clinical applications as the endpoint. And this requires knowledge of anatomy, physiology, as well as biochemistry. So I have worked on high resolution NMR spectrometer on liquid samples like cells and tissues. I have done animal MR studies and also MR studies on humans. So studies ranging from cells to animals to humans using MR has been a very exciting and satisfying journey for me. And I have contributed significantly to developing techniques for improving the diagnosis of brain infections and brain tumors. So this strong grounding I had in the technique of NMR and MRI has come in very handy now for my work in Ayurveda. So I continue to use this technique extensively to look into various aspects of Ayurveda. Yes, what I did between my PhD and acquiring the Ayurvedic medical degree is helping me a great deal in studying Ayurveda.
Right, ma'am. And it's quite interesting how it has fed into your current work and research as it stands. But what is even more fascinating is what made you go for a 5.5 years, long undergraduate medical degree in Ayurveda when you were at that point in time already an established biomedical MR physicist and scientist?
So my work involving developing techniques for differential diagnosis of brain pathologies had forced me to study anatomy, physiology, and neurochemistry. So due to my background in physics and training in physics, I was not familiar with these areas. So first I tried self-educating myself on these subjects and I found it very inadequate. And then I started attending the anatomy, physiology, and biochemistry classes in AIMS along with the undergraduate medical students. And it was then that I decided that I really cannot acquire knowledge in bits and pieces like the way I was trying to do. And I felt very strongly the need to have an insider's knowledge of the system I was trying to develop applications for. So I decided to do MBBS, and at that time I did not have any thought of doing Ayurveda. In fact, I don't have a family background in Ayurveda, nor had I ever seen anybody in my family take Ayurvedic medicines. To be frank, the thought of Ayurveda had never crossed my mind. So you may then ask how I drifted into Ayurveda. So it probably was a publication I came across way back in early 1990s, because it was at that time that the thought of doing medicine came to my mind. So the report was on memory enhancing capacity of plant called Shankapushpi. The plant extract was tried in mouse using maze experiments. So in this experiment, a bait is kept at one end of the maze and the mouse is trained to reach the bait. After administration of memory enhancing medicines, the mouse is expected to have fewer training sessions to find its way through the maze to reach the bait. So the conclusion of this study, which was published by some group, I don't remember the name of the group now, the conclusion was that the claims made by Ayurveda about the memory enhancing property of Shankapushpi was false. Now, I felt at that time that this was a very odd way of concluding the, giving a concluding remark for the study. So, as a scientist, I thought they should simply have concluded that the plant does not have this memory enhancing property. That would have ended the story. Anyway, to cut the story short, I found that they were using a wrong plant, because what they thought was Sankapushpi was not the name given to that plant in Ayurveda. And they were also studying the wrong parameter, because the plant had the property of Medhya and not Smritya. So there is a difference between Medhya and Smritya, which deals with memory enhancement. So I felt these mistakes were happened because there was no Ayurvedic doctor in that research group, because I got in touch with the group and I wanted to talk to the Ayurvedic doctor. They said, they didn't have any Ayurvedic doctor in the group and they did not think they needed one, since they said all the information was available in translation. Now, looking back, I feel this probably was the turning point for me. I decided to do Ayurveda instead of MBBS to see if there is any science in Ayurveda. So my intention to do MBBS was anyway not to go into practice, but for knowledge, for the sake of knowledge. So working in AIMS, I was anyway surrounded by experts in medicine. So I thought, why not Ayurveda? So interestingly, by that time I made a decision to do Ayurveda. I already had obtained admission for MBBS, but then I went on to do Ayurveda. So at that time, as you said, I had a permanent faculty position at AIMS and was also doing very well in biomedical MR. So I was pioneering this field in India and was the only woman at that point in time to have this expansive expertise in NMR, ranging from hardware to software to clinical applications in India. So with admission for MBBS, when I decided to do Ayurveda, I was told it was a professional suicide that I am trying, and I should not study Ayurveda. I mean, the study duration was 5.5 years. And but so although I myself was skeptical about Ayurveda, I decided I will have to find out for myself about the subject the hard way. So in fact, when I joined the 5.5 years course, I had told myself that if I found the subject unscientific, I will shift over to MBBS. But then I did not. I was also 47 years old when I actually acquired the degree. So it has been a very transformative thing for me. In my career, the decision to do Ayurveda, it was a risky decision, and but then it has really opened up my the focus of research for me.
Absolutely. And I think it's very interesting that you mentioned about this aspect of, going at it with an open mind, with an unbiased kind of, approach towards it, and looking at the scientific efficacy or the scientific validity of what you were kind of exploring, and thereof kind of measuring how you will go ahead with or not with that particular stream of thought. Now, Ayurveda, rooted in the ancient theories and centuries of clinical practice, today faces challenges in gaining recognition and appreciation in the contemporary world. Critics often point to the use of archaic language, for instance, and concepts as well that are not found in Western medicine. So this has led to questions about Ayurveda's compatibility with modern scientific terminology and its status as an enigma in the context of Indian medicine as well, to an extent. More importantly, there is a fundamental difference in that modern biomedical models are based on reductionism. An Ayurvedic model, if I'm not mistaken, is more holistic. So as per Ayurveda, the body is not just a sum of its parts. And the concept of interconnectedness and relations between different kinds of doshas, for instance, is primary. Can you please tell us a little about these divergences and how could they help us understand the human body possibly better?
So let me first respond to some points and then to the question. So you said critics point out to the use of archaic language. Well, just as English is a language of Western medicine, knowing this language does not make it archaic.
Right.
The second point, I would like to comment upon is you said that concepts are not found in Western medicine. Well, Western medicine is one way of looking at the human system. The complexities of the human system actually gives a very broad scope to have other perspectives as well, which is what Ayurveda does. So the concepts are bound to be different. In fact, we should be very happy that they are different. Otherwise, the limitations of one will seep into the other. Right. At another level, the concepts cannot be the same in two different sciences, especially when they have their origin in two different cultural milieu. So even in sciences which have the same origin, the concepts are different, right? So as regards compatibility about the terminologies used in Ayurveda with modern scientific terminology, I don't think there are any issues with compatibility. It is just that people are ignorant of what the system is. This said, the question I pose is why should it be compatible with modern scientific terminologies? Right. As I said, modern science is one way of looking at things. There is there are more than one ways to look at the same complex system. Moreover, the Sanskrit terminologies are, in my opinion, non-translatables. It is very important to retain the Sanskrit terms of Ayurveda so as to preserve the complete range of their meanings, because the Sanskrit terminologies are very loaded, and it's not possible for all the terms to be correlated and translated without losing the essence of that meaning. Now, you also said that its status is an enigma. I think anything that is not understood will always be an enigma. So the problem is then with the ignorant and not actually the science. Now, actually coming to your question on the divergences between modern and Ayurvedic medicine and how they could help us understand the human body. So as you rightly said, modern medicine uses reductionism to understand and manage the human system. So the human system, if you look at the model adopted by modern medicine, it's a reductionistic approach, and it reduces the entire human system to the level of the structural components, to the fundamental building block of anything physical in the universe. So we know that anything physical in the universe is made up of atom. So when you look at the model developed by Western, for Western medicine, so you have atom as the fundamental building block, and then you have molecules, organelles, cells, tissues, organ system, and then the entire organism. So it is a structural hierarchical model with atom as the fundamental building block. So here it is called a reductionistic system because you can reduce the entire human system to the fundamental building block of the physical aspect. Now, if you look at Ayurveda and the way it has conceptualized the human system, it's very different. So Ayurveda talks about existence of four domains. So there is a structural domain, there is a physiological domain, there is a psychological domain, and then the domain of consciousness. Now, each of these domain is like a module, intra-connected. So, for example, if you look at the structural domain, it is connected by a network of channels. These in Ayurveda are called srotas. So, in fact, one definition of human body in Ayurveda is srotomaya. So, it says that body is nothing but srotas, nothing but a connection of channels. And if you look at the physiological domain, it is networked through a set of parameters defined by what are called vata, pitta, and kapha. Put together, they are referred as doshas. And the psychological domain is again intra-connected with psychological parameters defined by sattva, rajas, and tamas. And then the subtlest aspect of our human system, that is the consciousness, it is connected through levels of awareness. Now, not only are these four domains intra-connected, they are also interconnected. So there are parameters which connects the structural and the physiological domain, and between the physiological and the psychological domain, and the psychological and the domain of consciousness. What is very interesting is how the subtlest aspect of human existence, that is the domain of consciousness, it is connected with the gross aspect of human existence, that is the structural domain. So the connecting point between these two domains is the first level of awareness, which is the physical body. So as I said, the domain of consciousness deals with levels of awareness, and a human being should be aware very first of the physical existence, right? So this is the connect between the domain of consciousness and the structures. So it is the human system is conceptualized as interconnected, seamlessly interconnected whole, actually. And so I will not go into the details of all these domains, but I would like to convey something about the physiological domain, which deals with vata, pitta, and kapha. For the simple reason that this concept of vata, pitta, and kapha runs as an undercurrent to the entire understanding and management of health and disease in Ayurveda. So Vata, Pitta, and Kapha, they denote functions. So Ayurveda, unlike modern medicine, has gone for a functional classification rather than a structural classification to understand the human system. So Ayurveda has identified three functions, which it considers as very important to the functioning of human system. So Vata refers to the function of movement, Pitta to metabolism and transformation, and Kapha denote the structural growth, actually. And they refer not only to functions, but they also include in themselves a set of parameters which are biophysical, chemical, physiological, and also psychological in nature. So, for example, if you look at the kind of biophysical parameters that gets grouped under Vata, Pitta, and Kapha, they are dryness, fluidity, adhesivity, elasticity, stiffness, viscosity, roughness, etc. And Ayurveda also talks about pH. Of course, it does not use the term pH. It talks about acidity. The logical inference is that it denotes pH. Another parameter which Ayurveda lays emphasis on and includes under the classification of Vata, Pitta, Kapha, or is the temperature. Ayurveda does not de-link mind and the human body, at any level. So psychological parameters are also grouped under Vata, Pitta, and Kapha. So for example, creativity, anxiety, confidence, fear, patience, endurance, leadership quality, all these are parameters, all these and more actually or parameters which comes under VP and K. So what the Ayurvedic acharyas had done is that they had grouped psychophysiological functions under VP and K. So I should say that there are no psychophysiological functions which comes outside the purview of this classification of Vata, Pitta and Kapha. So all these parameters are connected with each other, they are networked. And when this network is in balance, it denotes health, and disease is considered a system perturbation in Ayurveda. And so the job of the Ayurvedic Vaidya is to get this system back to balance. So the major differences between the two systems are the different ways they have conceptualized the human system. One where mind and matter are considered separate, and the other where consciousness is also factored into the model and where everything is connected with each other. So right. This is to put in a nutshell right. How the differences between the two systems.
Absolutely. And I think, you have given a very important part of not wanting to necessarily put a concept, which is from the Indic knowledge system side from Bharat, into the Western kind of parlance, into the Western kind of framework. And that is part of this continued movement towards decolonization and not kind of aligning with what is given to us in terms of Western kind of terminologies and constructs. And is something which stands by itself, and one must appreciate it as it is. Now, within, you just mentioned about a point on consciousness, and of course, in Ayurveda, the main reason for any ailment is said to be prajnaparada, or the impairment of knowledge. And this relates to the idea that consciousness is the premise on which well-being and ailment kind of lies. And consciousness, as per modern science, however, has still not connected with the conceptualization of consciousness in the Indian knowledge systems. So, for instance, consciousness in modern science relates to neural correlates, for instance, while consciousness in Vedanta, for that matter, talks of an immutable reality devoid of attributes and constructs. So, can we, and rather should we, reconcile the traditional construction of Ayurveda in light of the modern understanding of consciousness?
Prajnaparada is not the main reason for ailments in Ayurveda. It is one of the reasons only. Mm-hmm. So Prajnaparada actually basically means making mistakes that will affect one's health, knowing fully well the do's and don'ts for healthy living. So for example, we know that smoking is injurious to health. So we have the prajna, we have the knowledge, we have the information that this is injurious to health. Still we go ahead and do the aparada. So we still do the mistake of smoking, and we land ourselves in trouble. So Prajnaparada actually deals with the mind, and consciousness in Ayurveda or Vedic sciences means Atma. So the contemporary science is still in the process of understanding and defining what consciousness is. So it nowhere is near the Ayurvedic understanding of Atma. So I think there is no question of reconciling the traditional understanding of Ayurveda, not as of now.
Right. Right. And you also mentioned, while speaking of consciousness, about one other very important part of medicine and physiology, which is the structural aspect of the human body. You spoke about the srotas, for instance, and there is this idea that the conceptualization of the human body is based on the Panchamahabhut as well. So when it comes to the mechanical aspects of the human body, even with, for instance, advanced forms of surgery, what can you tell us a little about the advances and the structural understanding of the human body and the utilitarian part of how Ayurveda is deployed?
See, structural understanding has always been part of Ayurveda, and it continues to be so. It is used in surgery and also while dealing with marma. So marma point, there are, Ayurveda talks about 107 marma points, and they denote meeting points of very important structures like muscles, veins, ligaments, bones, joints, etc. And these are located in anatomical sites. So, structures has played a major role in Ayurveda, in Ayurvedic understanding of the human system. And as I said, the entire conceptualization includes a structural domain as well.
Right.
And moreover, physiological functions can manifest only through structures. So, for example, the function of vata, the function of movement of limbs, can be seen only if the structures of limbs are there. So, this fact has been recognized in Ayurveda, and so it has never delinked, structures from physiology. One cannot.
Right.
And also, it never delinks dosha and dhatu. Dhatu are the structural elements, in Ayurveda. So, in fact, Ayurveda says disease occurs with dosha and dosha dhatu samurchana, which means that the aggravation of doshas has to take root in the structural entities for a disease to occur. So, structures has always been part of it. Of course, now surgery in Ayurveda has taken a backseat. In those days, it was a very major branch in Ayurveda. But even in those days, only when medicines failed to bring in cure for diseases, the patient was handed over to surgeons. So, but now, Ayurveda cannot compete with the advances made in modern surgery. So, there is not much of surgery that happens in Ayurveda. But when we talk about the pathogenesis of diseases in Ayurveda, and doshas and dhatus, they play a role together. So structures are very important in Ayurveda.
Right. And ma'am, you mentioned about the doshas just now, and the doshas are extremely important, essential, fundamental to the understanding of Ayurveda, of course. But to most of us, it is not quite always clear as to how the medically tested parameters or the realities of the human body, as we know it in common parlance, in modern parlance, so to say, connect with the doshas. And in kind of elaborating or expanding in that, could you please tell us about how we move from the theory of Ayurveda to practice with regards to the diagnosis and treatment of specific health conditions using the practices of Ayurveda?
See, because Ayurveda has understood the human system based on Vata, Pitta, Kapha, or in other words, it has categorized all the psychophysiological functions of the human system, as in terms of Vata, Pitta, Kapha. It has made this a common platform. It is a very ingenious way of, trying to use the same terminologies and language for diagnosis and treatment. So, all factors which impact health and disease, for example, like medicinal plants which are used for preparing formulations, and edible plants and food ingredients which are part of our diet, and also animals which are part of our diet, environment and lifestyle activities all speak the same language of Vata, Pitta, Kapha. So all these factors are classified in terms of Vata, Pitta, Kapha, and so are clinical symptoms. So, for example, if you look at the clinical symptoms, let me take example of pain.
Yeah.
So, if it is a shifting pain, so this is a very typical clinical symptoms in chikungunya. So, the joint pain used to shift from joint to joint, and this is considered because there is a movement of the pain itself, it is considered a vata associated pain. If the patient experiences a burning sensation or burning pain, then it is pitta associated pain. If the pain is dull and heavy, sometimes we have a dull and heavy headache, right? Our head feels very heavy and there is a dull nagging pain. So then it is kapha related. So let me take another example. Let's take the example of fever. If it is a fluctuating fever, that is, there is temperature in the night, but during the daytime, the temperature reduces. So this is a vata associated fever. And if the patient complains of a burning sensation in the eyes and maybe a bitter taste in the mouth, then it is a pitta related fever. And if the patient has a heavy cough and cold and a low grade fever, it is kapha related. So even a simple symptom as a disease like cold. Actually, cold is not a simple disease, right. But it has become so common, we call it a simple problem. So if the nasal discharge is watery, it is a Vatic cold. If the nasal discharge is slightly mucus and comes out with a yellow color, then and also discharges with a burning sensation, it is Pitta associated cold. And if the nasal discharge is thick white mucus, it is Kapha related. So all clinical symptoms are classified in terms of Vata, Pitta and Kapha. So there are no clinical symptoms which comes outside of this classification of Vata, Pitta and Kapha. So it could be COVID, it could be multiple sclerosis, it could be rheumatoid arthritis, it could be any clinical problem, disease. The clinical symptoms have to come under the classification of Vata, Pitta and Kapha. So when the patient presents these symptoms to the doctor, the Ayurvedic Vaidya, what they do is the symptoms tell them which dosha has gone out of balance, which dosha has been aggravated. So it could be vata or pitta or kapha, or it could be a combination. So the disease could have disturbance in vata pitta or pitta kapha or vata kapha, or all the three doshas, vata, pitta and kapha, could also be aggravated. So as per Ayurveda, the causative factor for disease is an imbalance in the doshas, and which is why it's always said, or at least the Ayurvedic doctors say, that Ayurveda addresses the root cause of the problem, because according to them, the root cause of the problem is an imbalance in Vata, Pitta, and Kapha. In fact, they can go even further back. They can identify the diet and lifestyle activities which would have caused this aggravation, because lifestyle activities and food items are also classified in terms of Vata, Pitta and Kapha. So once this diagnosis is made, strategizing the treatment becomes very easy, because Vata, Pitta and Kapha is a common platform for all these factors which play a role in causing the disease. So if it is, for example, Vata kind of Vata aggravated disease, then medicinal plants which reduce Vata or used for preparing medicines. Food diet which decreases Vata have to be taken, and the ones which increase Vata have to be avoided. And lifestyle activities which are again classified in terms of Vata, Pitta and Kapha. The ones which aggravate Vata have to be avoided. The ones which reduce Vata have to be kind of followed. So you see how the treatment is strategized based on the Vata, Pitta, Kapha based diagnosis, and the same terms are, as I said, used for these other factors which are factored into the treatment. So this is how Ayurveda actually diagnoses and strategizes the treatment. Another example I can give is the treatment for osteoarthritis. So in osteoarthritis, that the synovial fluid which acts as a lubricant between joints is reduced. Yes. According to modern medicine as well, this is the case. Ayurveda goes a bit further and tells that there is increased dryness in the system. And for that particular patient, the vulnerable organ is the joint. So the increased dryness, which has occurred throughout the system, has manifested as osteoarthritis for that patient. So here the therapeutic target is the dryness. And so, the entire treatment is a plan to reduce dryness and increase lubrication. So oil, the Abhyanga is given with oil, and food items which increase lubrication or prescribed food items which decrease lubrication or to be avoided, and medicines which increase lubrication or prescribed, and so on. So this is just a small example of how diagnosis is made and treatments are strategized in Ayurveda.
So thank you for that, Dr. Jayasundar, because that kind of lays out the entire very systematic method in which the diagnosis and treatment is undertaken of very specific health conditions and issues that you mentioned here. Whenever we speak of ancient extant traditions or practices, however, there is one question that still remains, and especially that comes up in the context of Ayurveda, and that is with respect to its relevance in today's context. So, for instance, a question that comes up often is, can Ayurveda help cure or address medical problems or diseases that were not there, for instance, necessarily years back when various celebrated techniques within Ayurveda were compiled and posited or formulated? So, for instance, could it help with enhancing the resilience against and curability with the COVID, for instance, which has been a major point of concern for humanity? So I would like to know your thoughts on that, please.
So Ayurveda is a theory-based system. Its theoretical framework defined predominantly by Vata, Pitta and Kapha. It gives scope for diagnosing any new diseases, even such as COVID. So we should bear in mind that the clinical symptoms we see now in any disease were there thousands of years ago as well. Fever, respiratory distress, wet and dry cough, cold, body pain, loose motion, constipation, skin allergies. All these symptoms were there 5,000 years ago, and they are there today, and they will be there in 5,000 years later as well. And I have already said that the symptoms are all classified in terms of BP and K. And so this makes BPK based diagnosis very easy. So, for example, COVID-19 was diagnosed as Vata Kapha Jvara, which is what many Ayurvedic Vaidyas they treated the COVID like a Vata Kapha Jvara. Now, this diagnosis is based on the set of clinical symptoms and whether these clinical symptoms come under Vata, Pitta, or Kapha. So it was a Vata Kapha Jvara. In fact, I know of Ayurvedic doctors who had successfully treated high-risk cases of COVID with multiple comorbidities as well during the first and second wave of COVID. So these results have been published as well. So you can, it's available in the net. So Ayurveda clearly mentions that as time goes by, new diseases would keep coming. So they did anticipate new diseases. And they also very clearly say that the environment would change and the properties itself, would change. So, which is why they had chosen properties which they felt would not change over a period of time. For example, the clinical symptoms. And so they say that as long as we diagnose the affected doshas, and for which they have given the framework. In fact, the concept of Vata Pitta Kapha is actually a theory of Vata Pitta Kapha. And so once you diagnose the clinical symptoms, the disease using the affected doshas, treatments can be planned and executed because all of them, all the factors, which play a role, which are required for strategizing the treatment, also are defined by parameters which would not change over a period of time. So this is why diagnosing and treating new diseases are not a problem, as is usually thought of in Ayurveda.
Right, ma'am, and that is very important because the way it has evolved and it will evolve is premised on something that is looked at as an exhaustive kind of basis of sorts, which can possibly characterize most of that which is there and which could be there in terms of health conditions and issues. Now, when we started our discussion, you mentioned about this very notable aspect of your journey, which is that you looked at it in an unbiased way. You looked at the veracity of it, the scientific truth in what you were pursuing. And so that fascinates me, of course, as a person from physics. And there are very specific studies that you have looked at. So, for instance, the use of medicinal plants in Ayurveda is based on ras, which is generally taken to represent taste as a sensory perception. The chemosensory parameter plays an important role in Ayurvedic pharmacology. And you have in the past used modern scientific techniques such as differential sensing and spectroscopic metabolomics to study this concept of rasa. And you've also undertaken laser-induced breakdown spectroscopy, the LIBS, and studied the phytochemistry of polyherbal formulations to validate the therapeutic use of such various kinds of anti-diabetic medication. So can you please share with us your insights from these applications of cutting-edge scientific methods for the purposes of analyzing Ayurvedic methods and practices and their veracity thereof?
See, when I studied Ayurveda, or when I started to study Ayurveda, something that really was very surprising to me is the number of metrics Ayurveda talks about. Right. So we generally believe that, at least, outside the Ayurvedic fraternity, people believe that Ayurveda is very empirical, very subjective. There are no metrics as we find in modern medicine. It is not true at all. So Ayurveda has metrics, much more metrics than modern medicine. This was a very surprise finding for me. And I thought there were many other things that really, kind of took me by surprise when I studied Ayurveda. But coming back to your question, so thanks for asking this question because it deals directly with the kind of work that I'm doing currently. So Ayurveda has its own pharmacological parameters to classify and understand the therapeutic attributes of plants, which can be used for medicines. So one such parameter is rasa, which in modern parlance can be translated as taste or chemosensory property. Knowing the rasa of a plant can predict pharmacological action as per Ayurveda. So for example, if something is madhura rasa or a sweet taste, then it has certain pharmacological actions in the system. Whereas, another taste, for example, a pungent taste can have different pharmacological actions. So these are understandings of the connections between rasa and pharmacological action from an Ayurvedic standpoint. So Ayurveda talks of 6 rasas: madhura, amla, lavana, and katu, tikta, kashaya. So that is a sweet, sour, and salt, and pungent, bitter, and astringent. So Ayurveda has documented over 8,000 plant parts based on the rasa. Each plant part can have either a single rasa or a combination of 2, 3, 4, or even 5 rasas. For example, garlic has 5 rasas, and amla, gooseberry, also has 5 rasas. So I think it is a phenomenal work that our Ayurvedic acharyas had done. It is not clear what kind of methodology they had used to arrive at the taste of these plant parts. It obviously is not simply tasting and telling, because it's not possible to taste and tell 2, 3, 4, or even 5 rasas. In fact, some of the plants they classify under just the sweet category. If you taste this, I have tried it myself, you cannot experience the sweet taste as we know it. So it is not a question of actually tasting and telling. There must have been a methodology. So my aim is to see if the analytical techniques, sophisticated analytical techniques that are there now can be used for fingerprinting this rasa. So if you look at this classification that Ayurveda has adopted, for based on rasa, you will see that from a modern botany point of view, there is nothing common between these plants. Yet Ayurveda has put them under one category. So when there are new plants which are not mentioned in the classical Ayurvedic text, it is very important for the Ayurvedic Vaidya to know the rasa of that plant. There is no point in telling him or her that the plant has anti-inflammatory property or antipyretic molecule. So these are redundant information to Ayurvedic Vaidyas. It is very important to find out, have a technique to measure the rasa objectively. So the broad aim of my study is actually to develop a technique or a set of techniques to objectively evaluate the rasa of a plant. So moving towards this aim is my work on metabolomics using a number of spectroscopic techniques, including NMR, which is my domain expertise. And the aim is to see if there is a fingerprint or common signature for the plants grouped under one rasa. I should say that the results I have obtained are very exciting, and I believe I am now moving towards a method to identify the rasa grouping of a plant. This, I believe, is going to be a groundbreaking work for Ayurvedic pharmacology in many ways. It can identify the rasa grouping of unknown plants. It can also be used as a quality control parameter. It can be used for standardizing Ayurvedic medicines. It will have a variety of uses and a lot of implications. Right now, the kind of research that's happening in medicinal plants generally is focused on identifying lead molecules or active principles. This, as I said, is redundant information for Ayurveda. Apart from this spectroscopic metabolomics that I am doing for chemosensory fingerprinting of medicinal plants, I also use MRI, functional MRI and MR spectroscopy to study the therapeutic effects of Ayurvedic interventions and also to study certain concepts of Ayurveda.
Absolutely. And I would like to kind of firstly congratulate you for this path-breaking work. I think it's a rather exciting piece of research which looks at the fingerprinting, as you mentioned, and has a very kind of rigorous manner of laying out a framework, a scientific framework that can do the process of fingerprinting, so to say. Coming to a very important aspect of medicine, which is connected to what you have looked at in the recent past, which is to do with the neurological systems, particularly with respect to, for instance, the meditative techniques that are derived from Tantra, which have brought about changes in the structure and function of the nervous system of practitioners. And you yourself have worked on juxtaposing certain kinds of tantric concepts, such as the concept of a subtle body of nadis, of mantras, for instance, with the relevant neuroscientific findings. So could you please tell us a little about this?
So I will not go into the details of this for want of time, but let me tell you the outcome of my work on mantra. So I had, tried to find out if there are measurable changes, not only measurable, reproducibly measurable changes in brain neurochemistry when mantras are chanted. And so for this, I had chosen Gayatri Mantra, which is considered one of the most powerful mantra, and it is expected to work on brain and intellect as well. So this study was carried out quite some years ago on healthy volunteers in a very, very controlled and scientifically rigorous manner. And the duration of the study was 9 months, and MR spectroscopy was done every week for the entire 9 months period for these volunteers. All the volunteers were uniformly trained by a same Prohit Pandit for recitation of Gayatri Mantra. So the pitch is the same, the rhythm is the same, the phonetics are uniformly the same for everybody. So all these, the differences that one can expect when mantras are chanted, where I was trying to get them out of the way, so that the results we can actually look into the results in a rigorous manner. So the first 3 months of the study was just a baseline study, where the volunteers were not reciting any mantra. So they just used to come. They were going about the routine, the daily routines, and they used to come every week to get MR spectroscopy done. Then the next 3 months, when they chanted the Gayatri Mantra 108 times every day, they used to get up at, during the Brahma Muhurt, they used to chant the Gayatri Mantra. And then again, once a week, I used to do the MR spectroscopy. And then the last 3 months was, again, there was no recitation of the mantra. So they went about the routines, and the aim was to see if the whatever effects were seen in the MR spectrum was sustained over the next 3 months. So the results were very interesting. So all the volunteers had a left-right asymmetrical distribution of neurochemicals. This is something you can see in any normal population. There is an asymmetrical distribution of neurochemicals. Incidentally, mine was the very first report, in world literature to report asymmetrical distribution of neurochemicals in the brain. This is before my work in Ayurveda, before I studied Ayurveda. So I was getting back to that study and seeing whether there were any changes in the left-right asymmetrical distribution during the chanting of Gayatri Mantra. The results showed that the left-right asymmetrical distribution of neurochemicals, which I studied in frontal cortex, was reduced and it started moving towards unity. And even 3 months after stopping the chanting, recitation of the mantra, the results, the effect was sustained actually. So, I mean, you can ask, what is the implication of it? The frank answer is that I do not know what the implications are, because at that time I did not connect it with any psychological assessment that would be required to make the connection. But what my study recorded was that there were reproducible, measurable changes in the neurochemicals in the brain. So that is the kind of long and short of my studies on mantra.
And that's absolutely fascinating, because it goes back to this premise or this belief that of the mantras themselves and the manner in which they have a very significant kind of effect on the neurological system of the individual, and therefore it's a seminal work as well. Now, coming to the reality of Ayurveda, or the way it is, being promoted, it has been kind of at the forefront, so to say, in the recent years. And the BJP government, the Union government, has been quite serious in its efforts to promote integrative medicine as well as Ayurveda. Following the setting up of the Center for Integrative Medicine and Research at AIIMS, New Delhi in 2016, it has also announced the establishment of Ayush ICMR, Advanced Centers for Integrated Health Research, in 4 of the AIIMS in the country last year. However, recently, the Indian Medical Association has, through a charter of demands, asked all political parties to maintain the purity of modern medicine, as they put it, speaking against what they called mixology. So how do you see this development?
I agree 200% with IMA. You may be surprised to hear this answer from me. Since they have very different viewpoints, and each viewpoint comes with its own advantages. And so mutual reference can be done, and certain practices, if need be, can be universalized. For example, Chara Sutra from Ayurveda has been found to be very, very effective in treating fistula, anal fistulas, and it is now being used even by allopathic doctors to treat fistula. So there are certain things that can be universalized, but a lot of discussion has to be carried out for that. But mixing the two systems, I think it will be diluting both the systems. And so I think there is a lot of discussion that needs to be done before we even talk of bringing the two systems together. We need to decide how do we do it without diluting any of the systems. So I'm completely with IMA on this.
Right.
But from a Ayurvedic standpoint, of course,
Right, of course, yeah. And I think that is an honest and kind of a standpoint which is endowed with, obviously, the integrity that you bring to the fore, and this whole idea of the mishmash, so to say, the mixology, is something that one has to be careful against. But having said that, of course, if one were to go about with the scientific methodology that you have followed in terms of characterizing and promoting Ayurveda, that is obviously exemplary in itself. Now, as a quantum physicist, I found one of your writings, quite fascinating, and I would like to bring our kind of discussion around with that fundamental piece of work that you've done, which is very interesting, which is to do with the system of quantum physics, or rather quantum logic, and Ayurveda. And you have gone at it in a slightly kind of metaphysical, metadynamical method of understanding at the conceptual level. So how do you see the two worlds of Ayurveda and quantum logic coming together?
Thank you for asking that question, because when that article came out, I was bombarded with questions and criticisms saying that you are a right-wing person, wanting to say that our ancestors knew quantum mechanics, and so thank you for giving me this opportunity and platform to clarify about this. See, when you talk of clinical medicine, the end point is the treatment. So whether it is homeopathy or Ayurveda or Siddha or modern medicine, the ultimate aim, endpoint and objective is to treat the patients who are suffering from diseases, and also to maintain the health of the healthy individual. So the treatment is defined by the metrics used in diagnosis. So the diagnostic metrics actually gives you the therapeutic targets. And so, for example, if let's say, for example, you take diabetes. Here, the therapeutic target will either be glucose, which is increased in the blood, or insulin, which is reduced. It can be either of the two. So the diagnostic metrics actually decides how the treatment is going to be targeted, and the diagnostic metrics itself is decided by how the human system is understood. So if the human system is understood based on structural entities, based on proteins and molecules and receptors and cells and organs, the diagnosis is going to speak the same language, right?
Right.
And as I said, the treatment is going to follow the diagnosis, right? Now the question is, can there be different ways of understanding the human system? I have already tried to convey that human system is such a complex system. It gives you a wide scope to look at it in more than one way. So modern medicine looks at it in a way where structures play a predominant role, and Ayurveda looks at it in a way where functions play a predominant role. But what actually decides how a system is going to look at the understand the human system, how the conceptualization is going to be done, this is dependent on the basic sciences which contribute to the medical system. So all medical systems are applied sciences, they are not fundamental sciences. So if you take the modern medicine, the fundamental sciences which have contributed to the development of modern medicine are physics, chemistry, and bio and mathematics. And similarly, Ayurveda also has fundamental sciences. But then, if you look at when you take physics as an example of the basic science which has contributed to modern medicine, what comes to one's mind is the technological developments which have, which physics has given to modern medicine for improving its diagnosis and also the treatments, right? But what people don't realize is the very fundamental contribution of physics is the worldview. So how it views the reality, that is what actually defines how the human system is understood. So, people often don't realize the importance of contribution of physics. The source of the differentiation actually starts with the worldview of the basic sciences. So if you look at the worldview adopted by modern medicine, it has adopted the worldview of classical physics. Physics itself has two worldviews. You know that there is a worldview from, coming out of the quantum physics, and there is a worldview which is from classical physics. So Western medicine has adopted the worldview of classical physics, which says that reality is made of discrete material entities, and which can be reduced. So here, in the context of biology, the material entity is the human system, and in sync with this worldview, reductionistic worldview, modern medicine has understood the human system based on the structures, right? It can reduce the entire structural aspect of the human system, the fundamental entities. Now, if you look at the worldview adopted by Ayurveda, it is diametrically opposite. While classical physics talks of discreteness and also a kind of separation between mind and matter, you know better than anyone that classical physics has brings out a disconnect between mind and matter. Now, the worldview adopted by Ayurveda is very different. It is, of course, based on Vedic sciences. It looks at the reality as interconnected and which cannot be separated or reduced in any way. So, in fact, the worldviews, have decided how the human system is understood. One is drawn from classical physics, as in the case of Western medicine. The other actually is from Vedanta, to be very, very precise. So it is just that the worldviews of Vedanta and quantum physics are very similar. The worldview of quantum physics is also diametrically opposite to the worldview of classical physics, right? So it is in this context that I had used the term quantum logic, and hence the title. So Ayurveda considers not only the human system to be connected from within, but it also makes a very seamless connection with the outside world. So it talks of the connection between the humans and the environment, and the seasons and the ecosystem and to even the cosmos. So in fact, Ayurveda very elegantly says that the human consciousness is, the whole world is an expansion of human consciousness. So it is because of this interconnected way that Ayurveda looks at everything and has modeled what is required for a pragmatic approach for treating, understanding and treating health and disease. This is why I use the word quantum logic.
Thank you, ma'am, for highlighting that. I think that is a very important point that you brought forth, and we have had this discussion in other sections of Satya Samvad as well, particularly that with Professor Shishir Roy recently. And the point is that this resonance, so to say, is often taken to be fairly literal, whereas it is often in terms of the conceptual understanding of the worldview, as you put forth very rightly so, and the correlative aspects and the contextual aspect of how quantum mechanics looks at things and classical physics looks at it very differently. So, ma'am, that has been a very, very kind of insightful and meaningful, discussion that we have had. We have brought forth a beautiful manner of fingerprinting, of looking at Ayurveda in the modern context with rigorous scientific tests. You have also mentioned about the aspect of meditative practices and how they have had a certain effect in terms of the study that you had undertaken. I would like to request you for any last words, parting words that you would have for the viewers.
So let me first thank you for giving me this platform and opportunity to share some of my thoughts on Ayurveda. It is I have studied Ayurveda, and I'm also looking at Ayurveda not as an Indian but as a scientist. So, like other systems, Ayurveda also has its limitations. It's not that it is a panacea for everything, but the when you talk of a complex system, there are two things that can be done. One is obtaining information about the individual components, which is what modern medicine has been doing, and the other, and then converting that information on individual components to a treatment, right? But the other thing that can be done, for a complex system is to find out a way of managing the complexity. So you cannot manage a complex system at a fundamental level. It is not easy at all. Ayurveda does not have these nuanced information on structural entities and components that modern medicine has, but it has somehow found out a level or a way to manage the complex system. So a human being has not only structural and physiological aspect, but now even modern medicine is understanding the importance of the psychological aspect and the importance of that, its role in health. And even spiritual, health is now beginning to be talked about. Consciousness is also being, tried. People are trying to factor in consciousness as well. So Ayurveda is already doing all these. So I think it's very important to look at this wonderful science in a objective way, leaving aside our emotions, and it's a huge amount of, it's a treasure house of information, and it's a very different way of handling a complex system. So as a physicist, I find this fascinating.
Absolutely, ma'am. I think this is a very important message that you have conveyed to us, which is that of looking at this very comprehensive, this very contextual and correlative science through the prism of modern techniques, modern characterization, and the way in which it not only helps us in terms of the utilitarian aspects, but also looks at the worldview at large and how we can look at it more holistic rather than a reductionist way of thoughts. I would like to again thank you, ma'am, for joining us today. It has been a wonderful session, and we look forward to hosting you possibly in the near future again on certain topics as you go along with your research and the exploration of Ayurveda in the modern context. Thank you, ma'am.
So thank you very much. Thank you for giving me this opportunity. Thank you.